Okay, so how you doing?
Levels are still a bit everywhere.
Right, because have you had bloods done or not? Here?
Not recently.
No, the last one we've got is horrible, but it's a long time out of date. You're due some more, aren't you?
I think so, yeah.
Yeah, okay. And they are everywhere, aren't they? So there's loads of 20s, yeah? There's no lows that I can see there. Are you having any hypos?
I had one just before I come.
Today?
Yeah.
Right. Are these any better than they've been?
Yeah, it's everywhere still.
Okay. You know that I need the diabetic specialist to have a look at you for this, yeah?
Yeah.
And we need them to see you sooner rather than later, don't we? Tell me how much insulin you take.
Well, I take 11 minutes in the morning, and then I have like between 18 or 24 or 26 of the Humalog with the 11 in the morning.
And then at lunch?
It's about 24, 28. I put it up to 28 lately.
And what about your evening meal? Is that your big meal of the day?
Yeah, if I have that, I take about 30 of that.
Are you not eating regularly?
No, I've gone off my food for about 3 months now.
Do you know why?
I'm suffering from depression as well.
Mm.
Yeah.
What are they doing about your depression?
I'm on 40 mg of citalopram at the minute.
Have you had any talking therapy?
Not yet.
Would you like to? Is there anything going on that you need to talk?
No, I'm just not motivated to do anything. I don't know what's in particular.
So there's nothing particularly worrying you? Would you like to talk to anyone about the diabetes? Because that can be tough, living with a long-term illness, can't it?
Not really, I'm just fed up of it being high, but I guess everyone gets fed up.
Some people find the confines and the complications of something like diabetes very difficult to deal with. It's a lifelong diagnosis and it affects nearly every aspect of your life. Having a chronic condition makes you depressed, and being depressed makes managing a chronic condition much more difficult, and the two are very definitely linked.
I'm going to send you back to the diabetic clinic.
Okay.
There's blood tests on the system. Will you book them for me, yeah?
Here.
Here,
Okay.
yeah. In fact, let's get you a blood test now, and then I can send you back to them when I've got the new results, yeah?
Okay.
If you change your mind about talking to someone, if you change your mind about talking to anyone around the diabetes, you get a message to me.
I will do.
Are you seeing anyone again about the citalopram?
Not that I know of.
What about hurting yourself?
No. But I had a hypo fit at the end of March.
Sarah had several admissions which have been directly related to her uncontrolled diabetes. Hypo is when your blood sugar drops. So if you think about when you feel really hungry, that horrible empty feeling, but magnify it so people feel trembly, shaky, sweaty, often become confused. In its most extreme forms, hypoglycemia will lead to coma and, if untreated, to death.
I don't have the intention to hurt myself, but if something like that happens, it's like take its course, basically.
That sounds horrible. You've been diabetic long enough to know that if you're not looking after yourself properly, then you are at risk of hurting yourself, aren't you?
Just not feeling to eat, but I'm forcing myself to eat now.
Not taking control of diabetes, not managing your diet, it's self-harm by neglect. So diabetics who are struggling with motivation will often say that they wouldn't deliberately do anything to hurt themselves, but sometimes they really just can't be bothered, and they're aware that that will then have an impact on their health.
What should we do next? What could we do next to help with that?
No,
Why not talk to someone?
not really been talked about it before and just fed up.
You think it's tied into diabetes? Might be an element of chicken and egg, mightn't there? You're feeling rubbish, so it's hard for you to keep on top of your diabetes. Your diabetes is rubbish, so that makes you feel depressed. Will you come back and see me after those blood tests?
Yeah.
And will you stay on the citalopram until then?
Mm-hmm.
And if you change your mind about talking to someone, will you let me know? You don't have to wait for the appointment to do that.
Okay. Just phone up and say, can I make an appointment with Dr. Bulger?
You just phone up and say, I'd like Dr. Bulger to give me a ring. And we crack on and we get the diabetic people to see you and try and bring your sugar down. Does that sound like a reasonable plan? I will expect to see you in a couple of weeks, yeah?
Yeah, that's easy.
Bye-bye.